Hi, and welcome to our program. I'm Brent Dodge, and today I'm going to be talking about a new form of treatment called Pain Reflex Release Technique, PRRT for short. I've been a physical therapist for nearly 18 years. I've done advanced training in orthopedics and manual physical therapy. And whereas these are very effective forms of treatment, I ran across a new form of treatment, this PRRT, about 4 years ago and was intrigued that people were getting great results, particularly with chronic and difficult pain situations. I've since gone to 3 of their classes, moving all the way through their advanced level coursework taught by John Iams, a physical therapist out of Poway, California near San Diego. John has been a physical therapist for 40 years. He's an inventor and developed this form of treatment and is teaching many professionals, including physical therapists. And I've had great results having gone through those 3 levels of training. Now, when you compare typical orthopedic manual physical therapy, you can say, well, this is great. Does this other type of treatment have any other additional benefit? And the proof really is in the pudding, and the fact that I went back and continued to gain more advanced training in the pain reflex release model because I was getting substantially better results. Now, that doesn't mean that pain reflex release technique is an end-all in itself. Oftentimes it's a nice complementary form of treatment with other types of orthopedic manual physical therapy. Here at Alpine Physical Therapy, we've begun using the pain reflex release technique. We've had a gigantic clientele. People who have come through had great results for headache, neck pain, jaw pain, TM problems, temporal mandibular problems, upper back, lower back pain. It has a wide variety of effectiveness. It is a unique form of treatment. Some people would say it's very different, and when we work with the cranial nerve system, which I'll talk more about, it's basically using various parts of the head, face, and neck to achieve results with getting muscles to relax, joints to begin moving better, and pain to resolve. And so it does look a little different than typical manual types of physical therapy, but very effective. This treatment works on the basis that we have natural reflexes that we're born with. Many of those reflexes go away, but 2 continue to either work for or against us. These are the withdrawal reflex or the startle reflex. If you'll think of being scared, somebody comes up behind you and you have an immediate reflex response to that stimulus. And that can have effect in our body, particularly as it relates to discomfort. Things that we've seen, things that we've heard that happen at reflex speed can become embedded within our systems and continue to cause chronic and ongoing problems. And it's this form of treatment that helps to actually release. Remember, pain reflex release technique. And by releasing these reflexes, we can oftentimes get immediate response. Remember, a reflex is extremely fast, and treating with reflexes can be very fast and effective. One of the things about pain reflex release is that it has an ability to treat various forms of pain and discomfort. We've been using it a lot with our spine patients, but it's been adaptable to many other forms of disabling and chronic pain. But here again, it's not something that's just for difficult pain complaints. It's great for sports performance, to improve focus, to improve mobility and flexibility as well. So we've had a great result at Alpine Physical Therapy using this form of treatment. Right now, I'd like to introduce you to one of my many clients that I've been able to work with and help with pain reflex release technique.
I've had a lot of pain over the years. As a child, I broke both of my collarbones and I was in a very bad car accident. So my neck has been in very bad pain pretty much my whole life. And Brent did a very quick treatment on me, and it was fabulous. I've tried lots of other stuff, massage, different icing it, heat, whatnot. I've tried everything, and Brent did a quick treatment, and I have not felt better in my life. It was fabulous. I loved it.
Right now, I'd like to give you a tip of the day on this topic, pain reflex release technique. Now, we've mentioned that this is a little bit of an odd form of manual therapy, but can have great effectiveness. And that's because we're trying to work around the head, face, and neck oftentimes to release the nerves that come to the face and jaw, particularly one of the cranial nerves called the trigeminal nerve. You've probably heard of trigeminal neuralgia. It's a bad form of headache or face pain. In this case, we're going to use the trigeminal system to help you begin to relax your shoulders, your neck, and something that you can do in 30 seconds and start really feeling some benefits, particularly if you have some discomfort in your head, neck, upper back. And here's what you're going to do. It's called a chin press, because basically you're going to be pushing up against your chin. Technically, it's called a trigeminal down regulation technique, but I'm going to show you the chin press, and here's how it's done. Basically, take your tongue, stick it out about ½ inch, bite down lightly. It looks like this. Next, take your fingers and form a column on each side. You're going to gently push up right in the soft area toward the front of the chin. So it's going to look like this from the side. Now remember, you're not pushing on the bone, you're pushing on the soft area just next to the bone. And watch out for these vital areas, the esophagus, trachea. You don't want to be pushing here in the center, you're off to the side. I recommend that you hold that for 30 seconds and do it every hour for a while and see if you don't notice some improved mobility in your neck and comfort in your upper back. For more information on pain reflex release technique, be sure to visit our website at www.alpineptmissoula.com, or if you have other questions, call us at the clinic at the Peak Health and Wellness Center at 406-251-2323.